In today's video, we will be discussing charting. Depending on the office you work at, you may be responsible for charting existing treatment on your own or assisting the doctor with this. If you are responsible for this, you should start with any x-rays, intraoral photos, and complete a visual exam of the patient's mouth. You will then chart any missing teeth, teeth that have had dental work, and any primary teeth or impacted teeth that the patient may have. Under the Treatment Planning tab, you will select Existing Other, then select the tooth that has existing treatment, then the procedure code. If multiple teeth have the exact same existing treatment, you can select them all, then select the procedure. All existing procedures will show in green. For missing, primary, or impacted teeth, you will go under the Missing/Primary tab. If the teeth are missing, select the teeth numbers, then click the Missing button. The tooth will then be removed from the chart. Multiple teeth can be selected at once. If you accidentally mark a tooth as missing and need to correct it, select the tooth number and hit the Not Missing button. If any primary teeth are present, select the tooth that you would like to change to primary, then click on the Primary button. When the doctor recommends treatment, click on the treatment plan selection under Inner Treatment column, select the tooth the doctor is calling out, and then select the procedure code that is needed. All procedures recommended will show in red. When a filling is needed, you can chart it in two ways. The first way is selecting the tooth number, then clicking the quick button that has the surfaces on it. The other option is to select the tooth number, click on the specific surfaces, then go under the General/Common tab and click Composite. When a crown or root canal is needed, you will select the tooth number, go to the General/Common tab, and select what procedures the doctor recommends. When extractions are needed, you will select the tooth number, go to the Oral Surgery tab, and click the type of extraction the doctor needs. They will specify if bone graft, gel foam, membrane, or any other codes are needed in addition to the extraction. When a bridge is needed, you will go to the Bridge Posterior section. You will select the two teeth that are the abutment teeth, or where the bridge is attached, and select Abutment. Then the fake tooth in between will be selected as Pontic. Follow the doctor's recommendations for the type of bridge material. If the patient wants a partial or denture to replace missing teeth, select the Denture tab and select the teeth needing to be replaced and the code that the doctor calls out. One note for crowns, bridges, partials, and dentures is when you chart it, make sure you double click on the code and select if it is an initial, meaning the first time getting one done, or a replacement, meaning they have already had one there even if it's not present anymore. If it is a replacement, you need to get an estimated date of original service from the patient, then click OK to save. If the patient is needing an implant, go to the Implant tab, select the tooth number, and hit the appropriate codes. For our office, you will need to select multiple codes and hit the tooth number each time before selecting the code. The doctors or hygienists may also code out the type of cleaning that is needed. You can select which type they call out by going to the Exam/Cleaning tab and selecting which type they need. If the patient needs an SRP 1 to 3, you will need to select the appropriate teeth affected by periodontal disease in each quadrant. You can select multiple teeth by holding Control at the same time and clicking Teeth. If you are unsure on which teeth to code, check with the doctor or the hygienist. Once the exam has been done and all treatment has been charted, go to the Treatment Planning tab to the left of your screen to organize the treatment plan. You will select the treatment that the doctor or patient would like to start on first by setting it as Priority 1. For the remaining treatment, you can discuss with the patient or doctor on how they would like to proceed with the rest of the treatment that they need.